Good morning. I'm Dr. Rashi Bhargava, Assistant Professor Pediatrics, Santosh Medical College and Hospital, Ghaziabad. Today my topic of discussion is breastfeeding. So breastfeeding is the best way of providing young infants with the nutrition they need for healthy growth and development. Exclusive breastfeeding is recommended up to 6 months of age with continued breastfeeding along with appropriate complementary foods up to 2 years of age. So lactogenesis we are going to talk about. Two processes are there, the prolactin reflex and oxytocin reflex. So what is a prolactin reflex? It's a milk secretion reflex. The more the baby suckles at the breast, the greater is the milk production. The earlier is the baby put to the breast, the sooner is the reflex which is initiated, and prolactin is produced during the night time also. What is the oxytocin reflex? So it is called as milk ejection reflex. Oxytocin is produced by posterior pituitary. It is responsible for the ejection of milk from the glands into the lactiferous sinuses. This hormone is produced in response to the stimulation of the nerve endings in the nipple by suckling, as well as by the thought, the sight and the sound of the baby. So some of the factors are there which reduce the milk production. What are they? Maternal factors, which is painful breast conditions, inadequate emptying of the breast, less frequent feeds, lack of night feeds, stress. And what are the factors which decreases the baby factors? The factors which reduce bottle feeding, dummies, supplemental feedings and the sick baby. Some of the factors which increases the milk production that are relaxed and happy mother, proper emptying of the breast, proper night feeds, frequent feeding, drugs like domperidone, metoclopramide and chlorpromazine. So what are the breast milk contents? It's a mixture of a protein, carbohydrates, fats, vitamin, minerals and protective factors. So component of the breastfeeding, protein is 0.9 to 1.1 gram per deciliter. Composition is lactalbumin and lactglobulin. Carbohydrates exist to 7 gram per deciliter and mainly consist of lactulose, galactose and HFOs. Fats is 3.2 to 3.6 gram per deciliter. Omega-2 and omega-6 are present in breastfeed. Water is around 88% and osmolarity is 286 osmol per liter. So what are the growth factors which are present in the breastfeeding? Breastfeed, so breast milk, so epidermal growth factors which causes the maturation of and healing of intestinal mucosa. Neuronal growth factors, what are they? Brain derived neuropathic factors, cell line derived neurotropic factors, ciliary neurotropic factors. They cause development of enteric nervous system, elevation of impaired peristalsis and neuronal survival and outgrowth. Insulin-like growth factors, erythropoiesis stimulation, vascular endothelial growth factor, angiogenesis regulation, and erythropoietin increasing of the blood cells, and adiponectin causes the regulation of metabolism and suppression of the inflammation. So what are the types of breast milk? One is colostrum. Milk secreted during the initial 3 to 4 days after the delivery is called colostrum. It is a small quantity, yellow and thick. It is rich in proteins, that is 10%, vitamin A, immunoglobulin components such as secretory IgA, lactoferrin, leukocytes as well as developmental factors such as epidermal growth factors. CMIGA is active in protecting the mucosal surfaces of these immunocompromised babies. By swabbling the oral cavity with colostrum, we are provided some of the protection to the oral cavity, the upper GI tract if any is swallowed, and possibly the upper respiratory tract. Then there is a transitional milk. It is secreted 3 to 4 days until 2 weeks. The immunoglobulin and the protein content decreases while the fat and the sugar content increases. Then there is a mature milk, follows the transitional milk. It is thinner and watery, contains all nutrients. Fore milk is the milk secreted at the start of the feed. It is watery and is rich in protein, sugar, vitamins, minerals and water. It quenches the baby's thirst. and hind milk comes later towards the end of the feed and is richer in fat that provides more energy and gives sense of satiety. For optimum growth, the baby needs both whole milk and the hind milk. So early initiation of breastfeeding is very important. A newborn is very active during the first half an hour, and if effort is to make to breastfeed, the infant learns suckling very fast. This starts the process of milk formation in the mother and helps early secretion of breast milk. Early breastfeeding also ensures that the baby gets colostrum. So signs of proper latch on, what are they? Baby's mouth should be wide open. The nipple and the most of the areola portion should be inside the baby's mouth. The baby's lower lip should be turned outward and the baby's chin is touching the mother's breast. So there are different positions of the breastfeeding. The sideline is one, the cradle is one, cross cradle, football position. So key points of good positioning are the head and the body of the baby are in a straight line. Baby's whole body is well supported. Baby faces the breast and nose being the opposite the nipple of the mother, and baby's abdomen touching the mother's abdomen. So how do you assess the breastfeeding adequacy? The softening of the breast after every feeding session. Baby sleeps well between the breastfeeding sessions. So passes urine at least 8 times in a day and crosses the birth weight by 7 to 10 days and gains at least 25 to 40 grams per day thereafter. So how long do you breastfeed? So newborns should be nursed for at least 15 to 20 minutes per breast every 2 to 3 hours. This comes about 10 to 12 feedings per day. 1 month or more, as baby gets older, his appetite will increase. He will nurse less frequently but more for a longer duration at each feeding session. By 6 months, the baby may breastfeed for 20 to 40 minutes per breast, 3 to 5 times per day. So what are the advantages of breastfeeding? So there are different advantages for mother, for baby, for family, and also for the nation and the society. So advantage of breastfeeding for the mother: helps uterine involution, reduces chances of PPH, provide contraception, most effective way of shedding extra weight gained during pregnancy, less likely to develop breast and ovarian cancer later in life, promotes mother-baby bonding, reduces the risk of postpartum depression, and no extra effort to feed the baby. So what are the breastfeeding advantages of the baby? As you all know, this is the best possible nutrition for the newborn. It reduces the incidence of ear infections, bronchitis, pneumonia, and diarrhea. It protects the child from colic, asthma, eczema, nose, and food allergies. It is essential for optimal physical, emotional, and mental development of the child and a higher IQ. Lower risk of diabetes, heart disease, lymphoma in later life, and lower risk of orthodontic problems. Advantages of breastfeeding for the family are no cost feeding, no extra burden, less health issues to the baby, and family planning. So advantages of breastfeeding for the society or the nation: infant mortality and morbidity rate decreases, less burden on the health infrastructure, save resources of the country. Common problems in the breastfeeding. What are the mothers faces the problems of in breastfeeding? So they are inverted nipples, sore nipples, breast engorgement, breast abscess, and nipple confusion. So inverted nipples, what are the remedy for that? There is a syringing method. How do you do that? The nipple is manually everted, stretched, and rolled out several times a day. A plastic syringe is used to draw the current problem. Nipple sheets can also be used for that. Then there is sore nipples, which is due to the incorrect attachment, frequent washing with soap and water, pulling the baby off the breast while he is still sucking, and may also result in sore nipple. What is the management? Hind milk should be applied to the nipple. The nipple should be edged and allowed to heal in between the feeds. Prevention: correct positioning and latching of the baby to the breast. Mother should be advised not to wash nipple each time before and after feeding. She can clean breast and nipple once in a day at the time of bathing. Then there is breast engorgement, which is caused due to incomplete, infrequent emptying of the breast. As milk production increases, the amount of milk in the breast exceeds the capacity of the alveoli to store it comfortably. Breast becomes swollen, they become hard, warm and painful. What is the treatment? It's local warm water packs, breast massage and analgesics. Milk should be gently expressed, and prevention, early and the frequent meals. Breast abscess. If the congested engorged breast, rat nipples, blocked ducts or mastitis are not treated in the early stages, breast abscess formation can occur. What are the signs and symptoms? There is high-grade fever, raised blood count. What is the treatment? Analgesics and antibiotics, incision and drainage. Breastfeeding must be continued from other breast. Nipple confusion is one term, and infant's difficulty with or preference for one feeding mechanism over other after the exposure to the artificial nipple is a nipple confusion. The best way to avoid it is to delay bottle feeding until breastfeeding has been well established, that is 4 to 6 weeks. So baby friendly hospital initiative, it is developed by UNICEF and WHO as an intervention to increase breastfeeding rates in the term population and to improve maternity care practices. So for that, there are some steps which are initiated by UNICEF and WHO, which is called as baby friendly hospital initiative. So there are 10 factors for the successful breastfeeding. What are they? First, have a written breastfeeding policy that is routinely communicated to all the healthcare staff. Secondly, train all the healthcare staff in skill necessary to implement this policy. Inform all the pregnant women about the benefits and management of breastfeeding. Help mothers initiate breastfeeding within half an hour of the birth. Show mothers how to breastfeed and how to maintain lactation even if they could be separated from their infants. Sixthly, give newborns no food or drink other than breast milk unless medically indicated. 7. Practice rooming in, that is, allow the mother and the infants to remain together for 24 hours a day. Encourage breastfeeding on demand. Give no artificial teats or pacifiers, also called as dummies or soothers, to the breastfeeding infants. And 10. Foster the establishment of breastfeeding support groups and refer mothers to them on the discharge from the hospital or clinic. These are the 10 steps which are initiated for effective breastfeeding. So this is all for the breastfeeding topic. Thank you so much.
Getting